So we have gotten questions from people wondering if these sort of couple of, sort of small waves, relatively smaller waves of cases that we've had constitute what we're going to see with COVID. Are we done, basically, with COVID? And what I'd like to just remind people is that we are at the beginning of this. When we don't have a whole lot of data yet to tell us how many individuals in our community have become ill since this began and how many might have some level of protection against this virus. But the best data we have so far is antibody testing on about 1,000 individuals, a little more than that in the county. And it suggests that probably somewhere around 1 to 1.5% of our residents have had this infection so far. When we talk about having herd immunity in the sense that we're not going to see large, sudden groups of people ill that would sort of threaten our capacity, typically for most entities, we're talking about 70, 80, for some viruses, it's 90% of the population having immunity. I think we can understand that it's going to take some period of time for us to have that number of individuals who have been infected and may have some immunity. And so we are not over this. We are going to continue, at best, we're going to continue to see some of these smaller waves with clusters of cases that we can handle in our medical setting. And obviously the thing that we're trying to avoid is an instance where rather than these smaller waves, we're getting just sustained growth over a long period of time that ends in a peak of infections that are difficult for us to manage. And so a lot of this is the navigation going forward, and it's why we're, even though people are, I understand, tired of restrictions, tired of masks, the problem is that they are just increasingly important. Some of these measures that we're talking about, like social distancing and masking, increasingly important as we move forward, so that we can assure that we continue this smaller wave pattern as opposed to this. And so I, again, ask for everybody to help out. COVID virus is out in our community. As the state opens up more, as the country opens up more, we're going to see a lot more mix of people. And it's just going to be increasingly important that we do what we can to protect ourselves and, again, to protect those most vulnerable in our county.
Good afternoon, Dr. Frankovich.
Hi.
It's June 3rd. We're here for the media availability. Has regular staff at Alder Bay been replaced by professionals who are trained in dealing with COVID?
I would say no. We have the state has provided some temporary assistance in the facility, and those workers have now left. And those individuals were meant to help as workers were sick and staffing was an issue. What we have done, because practically speaking, it's not really possible to turn over your entire facility to staff, and that resource isn't something that's easily available. What we do is we train staff extensively, and we put in a lot of time, both the state and local public health and EOC personnel, on making sure that they had all the appropriate equipment and that they were trained even more extensively in infection control prevention so that they could do their jobs well.
On Monday, some police were seen shaking hands with protesters. What is your advice about handshaking? Do you have concerns?
Well, I think obviously the message we've been trying to put out is for masking and for social distancing, which usually prohibits handshaking. And I understand it was an unusual situation, and I appreciate the gesture, but in general, I do prefer that people are social distancing.
Can you provide us with a description of contact tracing protocols?
So I just brought this. It's just an example of a case map that we have used in previous investigation. And we can do a more detailed explanation of these at some point, but just to give people a quick picture, again, what we do is we identify an initial case. In this case, it would be here. When we look at this contact tracing tree, basically through our investigation, we're trying to identify everything this person has done and where they've been and who they've been in contact with during their infectious period. So in this instance, we identified someone who had shared a carpool with an individual who had returned from outside the area and had never been diagnosed, but had some symptoms that were suspicious. And the thought with this investigation is that this original case may have originated here. This person, actually, this is a diagram of household contacts, and this is extended other contacts along here that we identified and quarantined. And this actually is a coworker who is positive, and interestingly had this group of coworkers in their workplace, 2 of whom became positive. In this chain here, which is another set of contacts, there is 1 positive. And again, this intersects again with this individual here, and then this chain as well. Overall, when we investigated this, we had more than 60 people in the case investigation and 7 cases resulting from this original case. And so I think what it highlights really is the fact that, some of us tend to think that this is a household issue simply, and that if someone in your house is not ill, you're all good. And I think what it points out is that an individual case, through their connections to other people, can actually impact multiple settings, like workplaces, like childcare or daycares, extended family in other areas. So the one case has the capacity to involve multiple others. And so 2 points really. One is the importance of contact tracing, because we were able to identify these individuals, get people tested, and identify cases so that we could isolate and quarantine them. But also, it just highlights for us the extended networks that people live in and how many people you connect with in the course of, say 3 days in your normal activities. And so this was when we were in strict shelter in place and people were simply working and coming home. You can imagine that as we ease shelter-in-place restrictions and people are participating in more interactions across the community, the potential for connections and transmission extends even further.
Thank you. Can you provide a narrative of a successful contact tracing during COVID-19?
Well, I think, again, all of these cases, I think the fact that we've been able to see historically, when we look at our data, these sort of peaks in cases where we get sort of some clusters and then we see a decline, has been evidence of some of the success of the contact tracing that we've been doing. And, mainly because we haven't seen extended high levels of transmission afterwards. So again, identifying cases early, quarantining and isolating individuals really helps to decrease spread throughout the community. So there are cases, obviously, and other counties have experienced this as well, where sometimes it's difficult to identify all the contacts. Sometimes that's just memory. Sometimes there are other reasons. But I think that the more successful we are at it, the better we're going to be able to help manage as we move forward.
As more and more places reopen and shelter-in-place restrictions are loosened, if there is a sudden, significant spike in cases or deaths, is there the possibility that the county will backtrack on our progress and close places again?
Well, I think we've said throughout this response that is a distinct possibility. We're trying to avoid that, and it's really part of the purpose of going slowly as we move forward and gradually just taking steps and monitoring as best we can, because there is that possibility. If we start to see very rapid transmission and we are starting to see a significant impact on our healthcare system, and we can predict that's going to be worsening rather than doing this in small waves, then we may need to. But obviously doing so is not something we would move too easily. It's if we have serious concerns that we're approaching a surge situation.
We know that DHHS is monitoring our current situation and COVID case count, but can you talk about what public health is doing right now to prepare for another possible peak of cases around flu season? What protocols or measures are being put in place to try to prepare for that possibility as much as possible?
Well, it's a really good question and something that's been on our radar, I would say, since this began, because we recognize that we have issues. Our hospital emergency rooms and hospitals get busy during flu season, just baseline. And so when we're looking at hospital capacity over these summer months, it's typically lower, much higher in the winter, and going to be more difficult to plan around. And so certainly part of the timing of this and easing our restrictions is partly because this is a time where we can help when we have increasing numbers of people getting ill. For the fall and the winter, what I would say is that we're going to be really really strongly encouraging people to get flu vaccinations. We do that every year, but it has special importance this year as well, because the more we can keep flu under control, the more hospital capacity we're going to have to be able to manage COVID, assuming that we are going to be in a place to do, need to do that. And I think, certainly at this time, it's hard to imagine a large enough percentage of our population having become ill by flu season that we're not going to have to worry about a lot of COVID cases. So yes, we are, just to add on to that, we are working with and talking to, sort of healthcare partners about what flu season will look like and what we can do.
Is anyone contemplating undertaking a randomized serology study of Humboldt County to get a better idea of the spread of the virus so far?
Well, what I'd like to see happen is at some point here, our Optum site should have the capacity to do the serology testing as well, which would give us a better representation of serology for our county and antibody prevalence. So that's what I'm looking for. I think it's one of the easiest places that we can get that serology done. We're also participating in a couple of work groups and looking at a couple of research possibilities to do this. But again, capacity for testing right now, there are things we'd like to do for surveillance, but we really need to preserve some capacity for our acute testing. Going forward, we're hoping to expand that because I think it's important information.
Some recent news articles have explored the idea of shelter-in-place bubbles or pods. A couple or a few households that agree to exclusively socialize with one another while remaining socially distanced otherwise. Apparently, this is part of New Zealand's official coronavirus policy. Is this a good idea in our context? Why or why not?
Well, it's again a really good question. This model has been used successfully, and we are talking about it in counties in the state. There are some counties. Mendocino County actually added this to their health order to use a social bubble of sorts. And the idea, as mentioned, is really to sort of say, who are almost extended members of my household that I interact with frequently, and try to get some limitation of contacts outside that group of people to limit transmission. And so I think the idea has some merit, and I think that we're actually exploring it along with some other counties in terms of how that might look here. The other thing, of course, that we're looking at is guidance on group gatherings. As we start to ease shelter-in-place restrictions, what kind of information can we give the public about safe numbers of people in gathering as we move forward?
Thank you, Doctor. Over the past week, you've repeatedly made reference to the need for people over the age of 65 or with underlying health issues to remain vigilant and shelter in place as much as possible. Is public health taking any steps or aware of any other groups doing so to help these populations shelter in place by arranging for the deliveries of food, meals, and other household goods for people whose only other option is to go out?
Sure. So, public health is not providing direct services to seniors in their homes right now. We've certainly been doing a lot of messaging about the need for, neighbors and family members to help protect these folks by helping them remain in their homes safely and providing the kind of services mentioned in the question. I do know that Humboldt Senior Resource Center is still doing meal provision for seniors, and if people don't have contact information for them, they can certainly call the JIC at the 441-5000 number, and we can help direct them to those services. Also, individuals can do the benefits call center, contact that. The number is 877-410-8809. And that can provide some assistance or in identifying other resources for individuals who are in their homes. But again, I'd just like to take the opportunity to encourage us, part of what we can do in response, everyone in the community, is to identify family members, neighbors, that we can assist by doing things like adding on their grocery items to our shopping that we do and helping them pick up prescriptions, all of those things that can help keep them isolated somewhat while we're out doing some of those essential activities.
When it comes to Humboldt County's confirmed cases, can you tell us how many of them, or roughly what percent, contracted the virus while at work?
So just on a quick look through of this, because it's not how we sort the data, I would estimate about 10% or so. So that does not include the individual at the workplace who was ill and may have originally started the chain of transmission, because those individuals, it's never quite clear where they picked it up in the first place. or we've identified travel or something else as the source in that individual. But for the other individuals in the workplace who do become ill secondarily that we attribute to that initial case, I'd estimate about 10%.
Thank you, Doctor.
Thank you.